how do we put a lid on the surging variant cases found on Canadian soil? CTV News infectious disease specialist Dr. Abdu Sharkawy joins me now from Toronto to discuss. Dr. Sharkawy, as usual, nice to see you, and we've got so many questions for you, but I want to ask you about the vaccine delays. It's 1 week, but not really. It may be a little bit more than that in the end. How devastating is this on the ground?
Well, let's not quibble about this. Any day that we don't have a steady supply of vaccines is lives that are being lost, particularly in long-term care facilities and places that house our most vulnerable Canadians who have suffered the most throughout this pandemic. So we can't sugarcoat that. On the other hand, we're in a pretty good place overall. I don't think many people would have bet that we would have had one, let alone more than one vaccine even available at this juncture of the pandemic. This is going to be a temporary setback. And while we're waiting for more vaccines to arrive, we're going to have to ration our supplies. We're going to have to triage things to the highest risk targets, and that's going to be people living in long-term care and those support workers who are taking care of them. And the rest of us are going to have to make do. And that's a difficult thing to wrap our heads around, but it's not impossible. If we look around the world and look at places that have very successfully controlled this pandemic, most of them have done it in the pre-vaccine era. We can argue that Australia and New Zealand are islands and it was easier to restrict travel. But there are lots of other countries around Southeastern Asia and places even like Uruguay that are not very similar in terms of their economies or their infrastructure, but they did it. And they did it through strict public health adherence and through good messaging. And we have to start taking a page out of that playbook right now and trying to make up for lost time and getting our bridge towards probably the next few weeks when we're going to be getting more ammunition to get more vaccines into arms, and that can be done.
So when you're saying you're talking about tightening restrictions here, and that's a debate. Is that what you would recommend? Like not only tightening restrictions, like a shutdown, like a serious, curfews. Is that what we're talking about? Because next week we won't be getting vaccines. This may occur again. We don't produce our vaccines. We are at the mercy of others in order to get the vaccines into Canada. So we have to kind of expect the unexpected. So while we wait, should there be a country-wide shutdown or shutdowns that are a lot more strict than the ones that are in place now?
No, I don't think that that's the solution. I think what we're going through right now is quite difficult for many people, including, of course, schools being closed, which has a really enormous effect throughout the community, both in terms of people who are tenuously employed and the social and emotional state of our children and our families. So I don't think that tightening restrictions further is going to help. I think what we now need to do is to become a bit more proactive. Let's try and develop some rapid testing infrastructure strategies that are going to help allow us to open up schools in a safe manner and to open up our economy. I think if we want to look at where we want to identify new areas for restrictions, I do think we're going to have to look at travel restrictions. We're going to have to look a lot more carefully at global travel, particularly knowing what we now know about South Africa and Brazil. Those variants look just as transmissible as the British variant, but potentially more serious in terms of their lethality. So as much as we don't want to impugn the travel industry and we want to allow trade and finance to occur through travel being unhindered, that's something that I think we definitely need to look at very, very seriously. And it can't really be delayed much further.
Yes, and the Prime Minister mentioned that today about, sort of canceling the spring break. Dr. Abdu Sharkawy, thanks so much for this. It was good to see you and good to hear the advice.
Thank you. Stay safe.